instance. Good afternoon, ladies and gentlemen. Let me start by apologizing. I am very sorry about the fact that we are starting late. I honestly believed we would be able to start at 4 p.m., but the discussions have been intense and have consequences, and therefore it was necessary to go through them with clarity. Fellow Kenyans, the coronavirus disease has continued to affect the world in an unprecedented way. Global statistics today indicate that there were 266,073 confirmed cases and 11,000 deaths. The epicenter of the virus has shifted from China to Europe. In Africa, confirmed cases as of March the 21st were 572, with 12 reported deaths. On Friday, we announced that there were no new coronavirus cases and that the 7 patients who were tested positive for the virus were undergoing treatment and were stable. We continue to monitor their progress, as well as the individuals who have come in contact with them. And I may add here that they continue to be stable. In the last 72 hours, however, we have received confirmation of an additional 8 cases who have tested positive for coronavirus. This now brings the total number of those who have tested positive to 15. Out of the latest 8 cases, 5 are Kenyans and 3 are foreign nationals. The foreign nationals are 2 French people and 1 Mexican. All the 8 are imported cases from Europe and America. The ages are between the age of 20 for the youngest and 57 years for the oldest. All the 8 came through the Jomo Kenyatta International Airport between the 4th of March and the 17th of March. And they all have been isolated at various facilities and are being monitored by our teams. We are tracing 363 persons who had come into contact with these patients. So far, we have also an additional 3 people waiting processing at Bagathi Hospital. The rest have been processed and discharged. All the patients, except the one who is at the coast, at Msambweni, are all in stable condition. The government is organizing to having the patient in Msambweni airlifted to Nairobi for further treatment. As I mentioned on Friday last week, our actions continue to be guided by the trends that we have observed in other countries. Evidence from other countries indicates that the number of infected persons increases dramatically in the second week following confirmation of the first case. I did further indicate that these coming 2 weeks are extremely critical for this country as we seek to contain the outbreak. We remain focused on emphasizing high levels of hygiene and the maintaining of social distance as the most effective containment measures. This morning, when we were launching the CT scan center in the Jomo Kenyatta Hospital, you will recall, those of you who attended the conference center, the press conference, that throughout the discussions with doctors from many centers in China, the French doctors as well, the emphasis was on exactly the same thing: the levels of hygiene and social distancing as an effective measure. Fellow Kenyans, the government has, in the first few weeks, announced various measures that are aimed at containing this virus. However, much to our disappointment, we have noticed that majority of our people have continued to ignore these measures and are behaving as if it is business as usual. As I cautioned last week, this disease is not a joke. Kenyans must treat this matter with the seriousness it deserves by adjusting and changing their lifestyles. If we continue to behave normally, this disease will treat us abnormally. Behaving normal under these circumstances is akin to having a death wish. Therefore, in addition to the measures that we have already announced, the government has today resolved as follows. Number one, all international flights are suspended effective Wednesday, the 25th at midnight. The only exception to this rule are cargo flights whose crew must observe strict guidelines. Those coming into the country between now and Wednesday, may they be Kenyans or foreigners, will undergo mandatory quarantine at a government-designated facility at their own expense. Countries wishing to evacuate their nationals must make their arrangements to do so within this period. Kenyans who are currently in foreign countries and will not have come back within the said period are advised to observe the guidelines issued in their respective countries, wherever they are. Number two, whereas we had allowed Kenyans and foreigners with valid residence permits to come into the country, we have observed that there are those who are not observing self-quarantine protocol. Consequently, NAC has decided that all persons who violate the self-quarantine requirement will be forcibly quarantined for a full 14 days at their cost, and thereafter arrested and charged in accordance with the Public Health Act. And I would like to add here that this will apply to a senior government official in Kilifi who defied and refused to self-quarantine, who is now being forcibly quarantined in a facility, and upon the completion of the period given by our health authorities, the person, the official, will be charged in a court of law. And this will be followed by each and every person who violate this. I would like to urge, particularly those students traveling from the UK, traveling from the US and other countries, to observe this rule very strictly. And it will be enforced. And further, I would like to appeal to the younger people who are coming not to be close whatsoever to the older persons, because as has been shown by statistical evidence elsewhere, as soon as the young people come into close proximity with older people, the older people begin to die. So even as we talk about quarantining and we talk about distancing, it is important for people to remain alive to the fact that the older people are a lot more vulnerable. 3, effective midnight tonight, all bars will remain closed until further notice. Restaurants are to remain open, but only for purposes of facilitating takeaway services. This is meant to secure the social distance requirement, noting that the increased risk of transmission that those facilities can cause. Further, in order to give effect to the social distance requirement in public transport sector, all public service vehicles must adhere to the directive issued on Friday, March the 20th, failure to which the respective SACCO licenses will be revoked. The Inspector General of Police, who is present with us here today, has been directed to enforce this directive. Lastly, having noted the non-compliance of individuals, may they be in religious organizations, may they be in other social gatherings, as issued on the 20th of March, the NAC has directed the suspension of all church, mosques, funerals, and other social gatherings, and funerals are restricted to immediate family members only. Members of the Fourth Estate, you will remember that the experience of Italy started exactly the way we are behaving, where we have told people not to go into gathering, but some of them have decided, because of tithe and because of contributions in a church or because of contributions in other gatherings, that they must continue to do so. We all know what is happening in Italy today. Yesterday, 789 people lost their lives in 24 hours. There is nothing that we have done that is not going to give us exactly the same experience if we exhibit exactly the same behavior. It would be responsible of this government to allow this sort of behavior to continue, knowing very well what consequences they are. When you go into this kind of social gatherings, it is almost like committing suicide in the long run, in the medium term. And the social media today is abuzz with individuals who are nauseated by the behavior that Kenyans are exhibiting, even as we know the circumstances that are ahead of us. Once again, We are aware that these measures may be inconvenient, but I assure you that they are necessary to meet the objective of keeping Kenyans safe. Long after coronavirus has been secured, we will still have weddings, we will still have churches, we will still have mosques. But what is the point of continuing with these institutions as if nothing is happening and cut your gathering post-coronavirus by half? What is the logic? What is it that I do not understand when we tell Kenyans this is not a joke? So in the coming week, you will be observing enforcement measures that the government will have to take to make sure that what we are saying is correct. Even gatherings within the streets that are unnecessary should not be held. Stay at home. Stay at home. If you are not doing anything in the town, if you are not doing anything in the shopping center, if you are not doing anything in the dukas and kiosks, if you are not doing anything in the market, we shall only be opened along guidelines that the security operators are going to observe. Go home. Stay at home. People are getting sick because they came in touch with somebody else. The people we are talking about, the 8 people we are talking about, some of them are tourists. They have been to the pubs, they have been to the hotels, they have come in touch with some of us, and you don't know, as you speak next to your colleague, you don't know who is sick. And therefore we are saying this is not business as usual, and we will ensure that it will not be. I would like to ask the PS, Karanja Kibisho, to also say 1 or 2 things before also I ask the IG to speak to some of the points that we have raised.
Thank you very much, Waziri. And I'm addressing myself to the National Government Administration officers as a follow-up of a communication that we did last week. And for avoidance of doubt, National Government Administration officers range from the regional commissioners, county commissioners, all the way to the assistant chiefs. And I'm addressing them so that as Kenyans, when they come for enforcement, you already have the correct information. The Ministry of Health through the CS has laid out some of the directives that are meant to ensure social distancing and of course contact with individuals who could be sick. And what we have seen is total reluctance, because it has been more of asking people to comply on their own volition. And therefore, moving forward, and to make sure that we understand each other, the National Government Administration officers are hereby directed that moving forward, there will be no churches that will be open, they'll shut them. And if you are found with an open church in your area of jurisdiction, disciplinary action will be taken against you. There will be no gathering in mosques, in shrines, and in all places of worship. Like Waziri has said, all bars will remain closed from today midnight, and therefore, together with the National Police Service, the National Government Administration officers are hereby directed to ensure that that directive is complied with, and you will be punished if it's found that in your area of jurisdiction there are those entertainment spots, bars that are open. and we will, using our command center that we have opened here, be doing monitoring of compliance to these directives. And the National Government Administration officers further are directed to ensure that funerals are only attended by immediate family members who do not exceed 15 in number. And we shall enforce this without mercy. We also have directed them that they should not allow weddings, they should not allow merry-go-rounds, they should not allow birthday parties, they should not allow disco matangas, and all these social gatherings that when the minister talks of social gathering, as long as he hasn't mentioned it by name, we try to hide around it. So we are here as a Ministry of Interior and Coordination of National Government directing our officers to ensure moving forward that personal responsibility will be taken by them when there is violation of any of these directives. And because one of the other directives touches on the transport sector, where the enforcement is both by the National Transport and Safety Authority and the National Police Service, I would want to call upon the IG to come and direct the officers who are responsible for enforcement to do exactly that. IG.
Thank you, CS. I would also like to address the members of National Police Service. A duty of the National Police Service is enforcement of the laws and regulation. And to this aspect, National Police Service will start enforcing the Public Health Act. I'm giving direction to all the National Police Service officers. One, to start by this midnight enforcing the closure of the bars from the midnight. Secondly, to start enforcing the regulations of the matatus, observing the outlined regulations, observing distance in the matatus, the numbers of passengers in the matatus, and the health standard. We are also going to enforce and support the National Government Administration officers in enforcing all the social gathering and public gathering which have been outlined, that no social gathering, wedding, funerals, disco matangas, churches, and others which have been mentioned here. On top of that, I'm directing all the officers from the National Police Service to ensure that the self-quarantine is enforced. Those who will not observe the self-quarantine, after we enforce the quarantine, we'll follow up with those patients when they are through with the medical team, and we'll arraign them in court. We'll also do this with in conjunction with the Office of DPP. So I urge all the members of public to cooperate. Those who are going to cooperate, the National Police Service will be able to work closely with them. And definitely those who are not going to cooperate will enforce the arm of the law. Thank you.
In addition to the law enforcement agencies, we are also working very, very closely with the counties. And I would like to invite Governor for Isiolo, Mohamed Kuti, to say something regarding that cooperation, especially to do with the issuance of directives within the counties. Governor Kuti.
Thank you. I would like to take this opportunity to thank the cooperation that has been existing between the national government and the county governments in all the counties. The county emergency response teams have been formed, co-chaired by the county governors and the county commissioners. The purpose of this committee is to domesticate and adapt the national coronavirus emergency response team, which is here. And I am sure the message is now very clear that the government has heightened the level of caution, and it has moved from advisory to enforcement. And therefore it is important, number one, that all governors and all leaders in the counties take this message to the people, that people should stay home. That is the very strong message that the government is giving. Stay home and avoid unnecessary contact, unnecessary gathering, whether it is social gathering, religious gathering, or any other gathering. And I think the message the governors should go around and other leaders to go around to give to Kenyans now, so that we avoid. God has given us a chance to see what is happening in other countries. It did not start with us. It is important we learn from what is happening in other countries. There is Singapore, which has followed the orders of the government, and today their curve is flat, and they are able, the hospitals are not flooded, and they are able to take care of coronavirus in a manner that is manageable to that country. We have examples of countries that have failed to follow the advice of their government, and today the explosion is such that their facilities, however advanced those countries are, their facilities can no longer sustain the flow of patients, and the deaths are becoming too high, as you have already been told. 789 people died in 24 hours in Italy. That should be a lesson and a message. We should be a learning nation. We must learn and adapt and be able to take care of ourselves, especially our mothers, our grandmothers, grandfathers. And I would like to emphasize, this disease is not only for elderly, it affects everybody. But the problem is, the young people will be the distributors. And therefore, you should not feel safe. You are the one, the young people are the ones distributing. Therefore, we would like this message to be sent to the counties by the county government, the governors, the CECs, even the members of parliament, and all leaders now should provide leadership at the county level and enforce, or rather talk more, so that the enforcement part is done by the national government, and we keep telling our people exactly what to do, and the message is stay home. Thank you.
Thank you very much indeed. I once again want to take this opportunity to thank you, members of the media, for the continued support that you have given this whole cause. It is not a government cause. It is all Kenyans' cause. And I think this is a message that needs to be made very clear. I also want to thank those individuals who have complied with the law, because they are there, and they are a majority. A majority of Kenyans have actually complied with the law. But there are those who not only want to put themselves in harm's way, but also put other people who are completely innocent in harm's way. And I think allowing them is what we are saying we cannot do. The other group of people I would like to thank very, very sincerely is our frontline soldiers, who are the nurses, the clinic officers, the doctors, who continue to sacrifice in so many ways. Some of them are working 24/7. Others are buying even things with their own money. I've witnessed it myself. And these are people working. If people are working this hard to save Kenyan lives, why then would others want to demean this effort, to ignore this effort, and continue behaving badly? So I want to thank them with a special passion and tell them to please continue. Our job, and we have been directed by the President, is to ensure that the lives of nurses, through the use of equipment, through the use of PPEs, are properly protected. The nurses, clinic officers, the doctors, our entire medic troop is secured in all manner that we can. So thank you all very, very much. Maybe we can take one or two questions and then call it a day. I think the directives are pretty clear. Yes, please. As I had said last week, and we continue to say this, and they are saying this all over the world, the biggest enforcers of what we are saying is the people themselves. The biggest enforcers are the people themselves. Yes, police will henceforth patrol, and make sure that people are adhering to the law. But we cannot have a policeman for every person. This is a place where citizen responsibility, as I've continued to say, citizen responsibility is the key to the success of this initiative and these measures. Because we know, and we have told people, and there are people, if you go to Accra Road, for example, you said Marikiti, if you go to Accra Road, for instance, and I was there myself to observe it, you will see people actually taking this responsibility and doing the things they are supposed to do. As you enter the shop, they make sure that you are not entering too many of you, one or two of you. They rescue you outside. They wash your hands as you walk in. That is citizen responsibility. And this is how we are going to defeat this disease. There is no way we can follow each and every person around. Let's all do what we have to do individually. Yes.
Are you weighing the options of probably revealing the names of the